Hi, let's cover wound care basics. Three main things differentiate wound care back home and wound care in more advanced settings. Number one is types of wounds. Number two is level of technology and resources available. Number three is specialization in wound care. So let's go over them one by one. Number one, types of wounds. Back home, we see more of traumatic wounds, wounds from road traffic accident, laceration, burns. It's not to say that there are no wounds like that over here, no, but I'm just saying there's more traumatic wounds back home. And then also we see chronic wounds like diabetic wound all across the ages, young and old. So that's what we see back home. Over here, on the other hand, we see more of chronic wounds, diabetic wounds, PVD, that's a peripheral vascular disease, PAD, peripheral arterial disease, pressure injuries, cellulitis, and most of these wounds we see them in elderly patients. So that's the difference between the types of wounds we see. Another difference is technology. That's number two, technology and wound supplies. So wound care here is more than just a few solutions, gauze and adhesive tape. They have more advanced wound care products like antimicrobial dressings, advanced foam dressings, ready-made sterile dressing. Everything you see on this screen are wound care products, and this is not even just all of them. This is just some of them. So they do more than just the basic, solutions that we use. They have so many solutions. Back home, the solutions I used during my practice was hydrogen peroxide and methylated spirit. Over here, there are way more solutions, way more, products and supplies for wound care. Then number three, which is technology, difference in technology. Difference in technology is still under technology and wound supply, so number two. So they have wound vacs, and these wound vacs are specialized drains that supply controlled suction to a wound. It's a device, or maybe let me call it a machine, that suctions wounds. It promotes removal of excessive fluids, it reduces infection risk, and promotes wound healing. So this is co-managed with wound care nurses. And this now takes me to the third area of major difference, which is specialization. So over here we have wound care nurses. Back home, we don't have that, or at least not in my experience. We don't have nurses specialized in wound care. Wound care is done by general nurses, but here they have nurses specialized in wound care. These nurses take care of complex wounds. The general nurse, you are supposed to take care of the wounds from shift to shift and take care of simple wounds, but the main people who are in charge of wounds are wound care nurses. So those are the three differences: types of wound, technology and wound care supplies, and then specialization. Now let me just touch on some concepts. Number one is initial assessment. It's very important that whenever your patient comes in, you do a thorough assessment of the patient's skin. Some hospitals, their policy is for 2 nurses to do that skin check. And this is to establish a baseline to note and document if the patient has a wound, what kind of wound it is, what is the state of the wound, so that the hospital or facility knows that this patient came in with this wound and we took it from here. So as initial assessment, very important. Documentation, very important. Sometimes you are required to measure the wound and document. So that is one concept, initial assessment. Another concept is there are new terminologies, but they are not new things. So what I mean is that you may hear a terminology like wet to dry dressing. So it may sound new to you like it did to me, but it's not new. It's actually what you've been doing. What it simply means is that you moisten gauze with normal saline and place it on a wound bed and let it dry. When it dries, you take off the dry gauze, and then taking that dry gauze off means taking off dead tissues from that wound, which is mechanical debridement, which gives the wound a better chance to heal. So it's not like it's a new concept or a new thing. It's just that it has a new label or a new name. So wet to dry is the regular thing we do back home for mechanical debridement. I'll stop here. Thanks for listening. Make sure to like, share, subscribe, and follow for more.